Thank you. I choose this topic, integrating expertise across health disciplines. Across the room, over the last few years, we have had tremendous dialogue, bringing conversations across disciplines. Within the healthcare system, similar activities need to happen, and hopefully, after today's conversation, it will happen more efficiently as well. Radiotheranostics and clinical care require knowledge and expertise from multiple disciplines. Here's a bird's eye view of a hub-and-spoke model, also collaborating with a expert center with a satellite center, which makes it even more complex, and all the disciplines and experts that need to come together for a program to be successfully delivered, delivering high-quality care in a seamless type of way. Experts with multiple physicians to start off with, nuclear medicine, radiation oncology, oncologists, surgeons, depending on the space we're talking about. Nurses that have different levels of care in the treatment delivery space, in the outpatient radiation protection space. Physicists in charge of the machines calibration, technologists, therapists that may support a lot of the behind-the-scenes work, coordinators, finance people. All of these individuals need to be talking to each other to improve the care seamlessly for our patients. The disciplines in which the expertise is drawn from and our departments within hospitals are organized is also responsible for some of the silos that we experience in clinical practice. Some of these silos are visible, such as space in different areas, and we tend not to walk out of our office because we're so busy doing our own thing. And but in other areas, they are invisible. Some of these are financial, follow the money, jurisdictional, departments, and the disciplines themselves. And these silos create barriers for sharing knowledge, and more importantly, opportunities to grow together. In cancer care, the need for multidisciplinary collaboration is well established. One definition that I really like is from Choi et al. That simply states that multidisciplinary collaboration draws knowledge from different disciplines, but they stay within the disciplines. They are additive in value to our patients, but not integrative. In a rapidly changing world, with its complexities and dynamic situations, problems often cannot be solved within the discipline in isolation. What is required then is moving from that multidisciplinary to a transdisciplinary approach. The double arrow within these schemas are deliberate. They're denoting solutions identified not only by resolving the problem itself, a solution, but the solution itself contributes back to the disciplines and modify it and evolve them. It is my message and my hope that by building a transdisciplinary culture in our workplace that will enable effective and efficient growth of radiotheranostics. Individual personal motivation alone is not sufficient to break these silos. Systems-level solutions are needed to effectively enable transdisciplinary training and practice. Here are some of them that I can think of, but I'm sure there are more. Accreditation training programs need to be established for this new modality for radiotheranostics, or at least the content need to be incorporated and integrated into existing programs. Whilst education leaders may be motivated to do so, very often in the curriculum design, something have to give for some new things to be added in. But some of these subsequent system drivers also need to align for these accredited programs to be well received and to support growth. For example, for those who are already in practice, continuous professional development program opportunities need to be created. They need to be adaptable to the workplace so that talented individuals that are working can participate and grow the practices. Institutions and payers need to create roles that recognize the expertise of these individuals that bother to go and learn a new discipline, and attract new ones to come into the space, retain them, and expand. Similarly, adequate infrastructure and professional funding sources need to be in place. If there are not enough machines to hire these individuals to come and deliver, if there are no roles that recognize these extra training, individuals are unlikely to be recruited, even if they are motivated by the science. Appropriate career development pathways to attract and retain the talent is also important. Yes, we bring them into the space, but after working on it for 5 years, where are they going to go professionally? And if we don't develop these career pathways, it can also be stagnating. Clinical and educator leaders have written about this quite extensively, and some of these examples are listed here as to what need to happen, although significant variations still exist both locally and globally that requires a collective advocacy. I would say from a scale of 1 to 10, where 10 is where there's optimal interdisciplinary integration with our healthcare system to support the development of radiotheranostics, I would say we're at a 4. I want to highlight a few examples, though, 7 to be exact, of Canadian innovations using different strategies to cultivate interdisciplinary practices. Admittedly, many of my examples are Ontario-centric, but it is the principles that I wanted to highlight. Theranostic practices, while already part of the training curriculum for nuclear medicine and to a certain extent radiation oncology residencies, the opportunity for a particular early career physicians that finish their specialty training but is drawn to the space and want to develop expertise in the space is actually quite limited. I think until recently, interested clinicians will go to Australia or Europe and other places to gain some of these expertise. Fellowship programs are now available, designed to attract applicants from oncology-related disciplines to come in to learn about theranostics, where the training ground itself is also interdisciplinary in nature. We have such a training program within Toronto, University of Toronto, and similarly in London, Ontario, and a few others as well. Dr. Rinda Paul and Nellie shared their vision in London for a blueprint for a Radiotheranostics Academy, utilizing the resources across their clinical program, designed for professionals for both high-income countries and perhaps more importantly, catering to low and middle-income country physicians and healthcare professionals who want to be trained into this space. The SARS-21 program based at University of Toronto is not new, but I think it's a wonderful model dedicated to interdisciplinary training. Established in 2003, trainees who are already enrolled in graduate, residency, fellowship programs are selected based on the quality of their research proposals. They join this curriculum that is delivered over the course of a year. This is enabled by virtual meetings, designing resembling a team-based science that is dominating our innovation today, incorporating workshops, group projects, and capstone research day. The program has grown to welcome scholars from both Canada, North America, Europe, including Germany and UK, and to date, the alumni count graduates from across 11 countries. I've had the pleasure with working with some of the talented students from the Pharmaceutical Sciences program at U of T, offering master's and PhD programs. They welcome students from diverse backgrounds, both science and arts, in related disciplines, tackling questions with direct linkage to potential future applications for clinical transformation. I do like the tagline, "From here, go anywhere." Beyond longer-term training programs, such as the ones that I've just showed you, there are also short-term experiential programs introducing early career professionals to experts in nuclear science from McMaster and King's College London, Canadian Nuclear Laboratories, for example, providing trainees from outside the nuclear science space to gain core knowledge with career-shaping implications. Still a little differently, the Quantitative Imaging and Personalized Cancer Medicine program at University Health Network were originally designed to provide tools to enable multidisciplinary clinical trials requiring quantitative imaging. Beyond fulfilling its core function since its inception, is now home to a team of developers, engineers, physicists, and clinical investigators that problem solves around the space of quantitative imaging that is really quite core to this field of theranostics. And more importantly, it holds students for experience in this space for learning and exposure. Yet another strategy, the Pan-Canadian Quality Assurance Guidelines Radioligand Therapy Initiative, PCQRT in short, is the brainchild of Dr. Ramza and Nellie in London, bringing together a Pan-Canadian expert panel to arrive at a set of 59 quality indicators that was launched last year. And now it serves as the blueprint upon which existing and future theranostic programs will be measuring themselves against. Beyond the quality guidelines, the structure of the program enabled multidisciplinary, cross-disciplinary collaboration and creating this Canadian advantage. I truly believe that Canada is well positioned to create models of care that at once respect the need to provide a centralized expertise as well as distributed care. In Canada here, we have a unique opportunity to build a system that both works well for us and could serve as a useful model for potentially for other jurisdictions. Timing and interdisciplinary readiness is everything. Our cancer care system across Canada has lived with waiting lists and learned about the need for proactive planning and could provide a valuable framework, including other frameworks that exist, such as the PET imaging network, that would enable this. The schema that you see in front of you represents the different cancer centers linking to potentially their partner sites and satellite sites, which is exactly the model that Ontario wants to implement. So my take-home message to you then is breaking down silos, building interdisciplinary expertise is key for radiotheranostics to reach its full potential. Building a framework with system-level enablers will motivate and retain talent. A healthcare system that is suitably enabled with strong transdisciplinary culture may be a perfect environment for us to design, evaluate, and refine theranostic program implementation that can be shared with the world. This is expected to be patient-centered, equitable, efficient, and adaptable to our population's needs. Thank you.